Welcome to the Senior Health video. This video will talk about hidden primary and secondary Sjögren's symptoms you must know. Now, have you ever felt exhausted for no reason? Your eyes burning like sandpaper and your mouth so dry it sticks shut at night? Millions of Americans live with those same mysterious symptoms, brushing them off as aging stress or dehydration. Yet behind these harmless-looking signs may hide one of the most misunderstood autoimmune diseases in modern medicine, Sjögren's syndrome. It is far more than dry eyes or dry mouth. It is a silent internal storm where the immune system meant to defend the body begins attacking it from within. What starts as simple dryness can slowly turn into nerve damage, lung inflammation, kidney failure, or even cancer. Most shocking of all, nearly 1 in 3 cases are completely misdiagnosed or missed for years, allowing irreversible harm to unfold in silence. This condition does not discriminate by fame or wealth. It affects teachers, nurses, grandmothers, and neighbors who wake up every day feeling drained without knowing why. Many are told their fatigue is normal, their pain imaginary, or their dryness unimportant. But the truth is devastating. Sjögren's can strip away energy, destroy organs, and in severe cases increase the risk of lymphoma by more than 40 times. It is a disease that hides in plain sight wearing the mask of aging until it is almost too late. Yet there is hope. Understanding how this illness works is the key to stopping it before it steals more lives. In this guide, viewers will learn how the immune system turns against the body, the difference between primary and secondary Sjögren's, the hidden symptoms doctors often miss the tests that reveal the truth, and the treatments that can protect long-term health. Knowledge can mean the difference between years of confusion and a life of clarity. And by the end of this video, every viewer will know exactly what to look for, what to ask, and how to take back control of their body before irreversible damage begins. Number 1, the autoimmune mechanism behind Sjögren's syndrome. Inside every healthy body, the immune system acts like a loyal guardian. It detects threats, fights off viruses, and then returns to balance. But in Sjögren's syndrome, something goes terribly wrong. The immune system forgets who the real enemy is and begins attacking the body itself, especially the glands that produce tears and saliva. What starts as a small internal glitch soon becomes a full-scale attack on the body's moisture system. The eyes dry out, the mouth loses its natural protection, and inflammation spreads quietly through the joints, nerves, lungs, and kidneys. Doctors from major U.S. research hospitals explain that this constant immune activation releases toxic molecules that scar tissues and block normal function like rust forming inside a machine. Under a microscope, damaged glands appear filled with white blood cells instead of healthy fluid-producing cells. This explains why so many people experience dryness, fatigue, and pain long before diagnosis. It is the body's own defense system turning into its greatest threat. Recognizing this autoimmune storm early can help stop the destruction before it reaches vital organs. Understanding this invisible attack is the foundation for recovery and awareness. But knowing how it works is only the beginning, because another hidden factor makes Sjögren's even more deceptive and far easier to miss. Number 2, the 2 faces of Sjögren's syndrome. After understanding how the immune system turns against the body, the next challenge is recognizing that Sjögren's syndrome exists in 2 distinct forms. This difference often determines whether a patient gets diagnosed early or spends years searching for answers. Primary Sjögren's appears on its own with no other autoimmune disease attached. It usually starts with classic symptoms like dry eyes, dry mouth, or swollen glands slowly spreading to the joints, nerves, or internal organs. In contrast, secondary Sjögren's hides behind another autoimmune illness, such as rheumatoid arthritis, lupus, or scleroderma. Because those conditions are louder and more visible, Sjögren's often slips under the radar. Doctors may blame fatigue on lupus or joint pain on arthritis, never realizing that the patient's chronic dryness or nerve tingling comes from a second disease running silently in the background. Studies from American rheumatology centers show that nearly half of all cases are secondary, meaning millions live with dual autoimmune attacks without knowing it. Recognizing the difference matters because untreated secondary Sjögren's can lead to irreversible nerve and organ damage. Every dry eye, every swollen joint could be a clue pointing to something deeper. Understanding these 2 faces is essential for early detection and treatment. But even that knowledge doesn't tell the whole story because the first visible sign of Sjögren's often begins where most people least expect it, in the eyes. Number 3, the first symptom. Dry eyes. Among all the early warning signs, dry eyes are often the first cry for help from a body under autoimmune attack. It begins subtly, like waking up with a gritty sensation or feeling as if tiny grains of sand are trapped beneath the eyelids. Many people blame it on aging, allergies, or screen fatigue, but the truth runs far deeper. In Sjögren's syndrome, immune cells invade and destroy the tear glands, shrinking them over time until they can no longer produce enough moisture to protect the eyes. What follows is burning redness, blurry vision, and a painful sensitivity to light that makes reading or driving nearly impossible. Eye specialists often prescribe lubricating drops, but these only treat the surface. The real issue lies within the immune system itself. Studies from the American Academy of Ophthalmology confirm that chronic inflammation in Sjögren's damages the cornea, increasing the risk of infection and even vision loss. The Schirmer's test, a simple strip of paper placed under the eyelid, can reveal dangerously low tear production in just 5 minutes. Ignoring this dryness means letting the disease progress unchecked. Recognizing it early could save sight and stop further damage. But understanding the eyes is only the first step, because the same immune attack soon travels deeper, reaching the mouth where the next wave of symptoms begins. Number 4, the second symptom. Dry mouth. After the eyes, the next target of Sjögren's syndrome is the mouth, one of the most overlooked yet vital parts of the body's defense system. When the immune system attacks the salivary glands, saliva production drops dramatically, leaving the mouth parched and uncomfortable. At first, it feels like mild thirst or a need to sip water more often, but soon even soft foods like bread or rice become difficult to swallow. Speaking for long periods feels tiring, taste weakens, and nights become restless as the tongue sticks to the roof of the mouth. This dryness is far more than inconvenience. Saliva protects teeth, gums, and digestion, and without it, the entire oral ecosystem collapses. Patients begin to experience frequent cavities, gum infections, mouth sores, and even tooth loss. Dentists may blame poor hygiene, but studies from major U.S. dental schools reveal that persistent dry mouth is one of the clearest indicators of autoimmune damage. Salivary gland imaging and tests such as sialometry can measure how little saliva remains, offering clues before irreversible harm occurs. Recognizing this symptom early can prevent lifelong dental complications. But the story does not stop here, because the same inflammation that dries the mouth can also cause painful swelling in the glands themselves, a sign that something even more serious may be developing. Number 5, the third symptom, swollen salivary glands. As the immune attack deepens, many people with Sjögren's begin to notice swelling around the jaw or in front of the ears, where the large salivary glands called the parotid glands are located. At first, it may feel like a dull ache after eating or a slight puffiness that comes and goes. Over time, the swelling becomes more visible, distorting the shape of the face and often causing pain or pressure that makes chewing or resting the head uncomfortable. What makes this symptom dangerous is that it is often mistaken for infection or a blocked duct, leading to repeated rounds of antibiotics that never solve the problem. In reality, these glands are under constant immune assault. The inflammation gradually replaces healthy tissue with scarred, non-functioning cells, leaving the mouth even drier and more vulnerable to infection. Medical imaging, such as ultrasound or MRI, can reveal the damage early, while biopsy confirms the autoimmune pattern. According to research from U.S. rheumatology centers, persistent or uneven swelling of these glands can also signal a higher risk of lymphoma, one of the most serious complications of Sjögren's. Paying attention to this visible warning can literally save a life. Yet understanding the swelling is only part of the journey, because the next sign of Sjögren's is far less visible, a deep, crushing fatigue that invades both body and mind. Number 6, the fourth symptom. Fatigue and brain fog. Beyond the visible dryness and swelling, one of the most exhausting parts of Sjögren's syndrome is the relentless fatigue that drains both body and mind. This is not the usual tiredness after a long day. It is a heavy, bone-deep exhaustion that lingers even after a full night's sleep. Everyday tasks like walking to the mailbox or preparing a meal can feel overwhelming. Alongside this comes brain fog, a mental haze that clouds memory and focus. People forget names, lose track of conversations, or struggle to recall simple words, leaving them frustrated and misunderstood. Researchers from the National Institutes of Health explain that this fatigue comes from constant inflammation and immune chemicals circulating in the bloodstream, disrupting energy production and brain function. Friends or even doctors may dismiss it as stress or depression, but for Sjögren's patients, it is a physical signal of systemic inflammation. Lifestyle pacing, balanced nutrition, and gentle movement can help restore some energy, but true relief only comes when the underlying immune storm is managed. Recognizing that this fatigue is real is the first step toward recovery. Yet as draining as this exhaustion can be, another symptom begins to take hold, one that creeps into the joints and muscles, quietly reshaping how the body moves every single day. Number 7, the fifth symptom, joint and muscle pain. After fatigue takes its toll, joint and muscle pain often emerge as one of the most persistent and frustrating symptoms of Sjögren's syndrome. It usually begins subtly with stiffness in the morning or an ache that lingers after mild activity. Over time, the pain becomes constant, spreading through the hands, knees, and shoulders, making even simple tasks like opening a jar or climbing stairs feel difficult. Muscles may feel sore and heavy, as if the body has run a marathon it never trained for. Doctors sometimes confuse this pain with rheumatoid arthritis or fibromyalgia, but the underlying cause in Sjögren's is different. The immune system attacks the connective tissues and joints, releasing inflammatory molecules that damage cartilage and fibers. Unlike rheumatoid arthritis, this pain can shift unpredictably from one side of the body to the other, often paired with dryness or fatigue that other conditions lack. Studies from American rheumatology clinics show that treating the inflammation early with anti-inflammatory therapy and lifestyle adjustments can protect mobility and reduce long-term damage. Stretching, omega-3 fatty acids, and maintaining gentle activity help keep joints flexible. Pain in Sjögren's is not imaginary, it is the body's cry for balance. But the pain does not end there, because as the inflammation deepens, it begins to strike the nerves themselves, sending sharp signals of burning and numbness that reveal the next stage of damage. Number 8, the sixth symptom, peripheral neuropathy. When Sjögren's syndrome reaches the nervous system, the result is a painful and often frightening condition known as peripheral neuropathy. It begins with tingling in the fingertips or toes, a subtle buzzing that feels like pins and needles. Over time, the sensations intensify into burning, stabbing, or numbness that can spread through the arms and legs. Some describe it as walking on shattered glass, while others feel their hands growing weak and clumsy. These nerve changes do not come from aging or poor circulation. They come from the immune system attacking the protective coating that surrounds the nerves. Neurologists across the United States have found that this autoimmune damage disrupts communication between the brain and body, leading to loss of balance, muscle weakness, and chronic pain that standard medications often fail to relieve. Because the symptoms resemble those of diabetes or multiple sclerosis, many patients spend years visiting specialists without answers. Nerve conduction studies and MRI scans are vital tools for identifying this damage early. Proper management can slow progression and prevent permanent loss of sensation. Neuropathy is one of the most silent yet disabling effects of Sjögren's, warning that the disease has reached deeper systems of the body. But even this nerve damage is not the final warning, because Sjögren's can also surface through one of the body's largest and most visible organs, the skin itself. Number 9, the seventh symptom, skin and vaginal dryness. As Sjögren's syndrome continues its silent progression, the loss of moisture begins to affect the skin and the most delicate mucous membranes of the body. The skin, once smooth and resilient, becomes dry, itchy, and fragile. Small cracks appear, healing slowly, and sometimes leading to painful rashes or infections. No lotion seems to last, because the problem does not lie on the surface. It begins inside, where the immune system disrupts the glands responsible for keeping the skin hydrated. For many women, the dryness extends beyond the skin, affecting vaginal tissues and causing discomfort, burning, or pain during intimacy. Gynecologists in the United States report that up to 70% of women with Sjögren's experience these symptoms, often mistaking them for normal hormonal changes. The lack of natural lubrication can also lead to recurrent urinary tract infections and inflammation that interferes with quality of life. Medical solutions like prescription moisturizers, estrogen creams, or specialized lubricants can help restore comfort, but real healing requires controlling the immune imbalance that causes the dryness in the first place. These symptoms can feel isolating, but they are common and treatable once identified. Still, dryness on the surface is only one layer of the disease, because Sjögren's can quietly reach deeper into the digestive system, liver, and kidneys, where the stakes become even higher. Number 10, the eighth symptom, digestive and organ complications inside the body. Sjögren's syndrome can silently extend its reach beyond the glands to affect the entire digestive system and internal organs. Many patients first notice difficulty swallowing as food seems to stick in the throat or liquids cause choking. This happens because inflammation and dryness interfere with the normal flow of saliva that helps move food down smoothly. Over time, acid reflux, heartburn, and stomach pain become constant companions. What appears to be simple indigestion is often a deeper sign of autoimmune damage, spreading through the esophagus, stomach, and pancreas. Gastroenterologists in American research hospitals have linked Sjögren's to chronic inflammation of the liver, pancreas, and kidneys, a condition that can lead to serious complications if untreated. The kidneys are especially vulnerable, developing silent inflammation called interstitial nephritis that may progress to kidney failure over the years. Routine tests for liver enzymes, creatinine, and urinalysis can reveal problems early before permanent injury occurs. These internal signs often go unnoticed until they become dangerous, which is why recognizing them as part of the same autoimmune process is crucial. Protecting the gut and kidneys through hydration, balanced nutrition, and medical monitoring can prevent life-changing damage. But the body's internal warning does not stop here, because the same dryness that attacks within can soon reach the lungs, turning every breath into a reminder of how serious this disease truly is. Number 11. The ninth symptom, respiratory involvement. Among the most overlooked dangers of Sjögren's syndrome is its slow invasion of the respiratory system. What starts as a mild dry cough can evolve into constant throat clearing, wheezing, or a persistent feeling of chest tightness. Many dismiss it as allergies or seasonal irritation, yet inside the lungs, the same autoimmune process that dries the eyes and mouth is now drying the airways. When mucus production decreases, the lungs lose their natural protection, allowing dust, bacteria, and pollutants to irritate the delicate tissue with every breath. Pulmonologists across the United States have identified that long-term inflammation in Sjögren's can lead to interstitial lung disease, where scar tissue gradually replaces healthy lung cells. This scarring makes breathing difficult and limits oxygen flow, often mistaken for asthma or chronic bronchitis. If untreated, it can cause lasting shortness of breath and fatigue that worsens over time. Pulmonary function tests, CT scans, and early evaluation are vital for detecting these hidden changes. Simple steps such as using humidifiers, staying hydrated, and avoiding smoking can help preserve lung health. Recognizing respiratory symptoms early means catching the disease before it becomes irreversible. But even as breathing becomes harder, another shadow of Sjögren's rises, a far more serious threat that connects this autoimmune condition to cancer itself. Number 12, the 10th symptom, lymphoma risk. One of the most alarming and least discussed complications of Sjögren's syndrome is its strong connection to lymphoma, a cancer of the immune system. Years of continuous inflammation force immune cells to multiply uncontrollably, and in some cases, these cells begin to grow abnormally, forming cancerous clusters in the lymph nodes or salivary glands. The numbers are striking. Studies from major American cancer institutes reveal that people with Sjögren's face up to a 44 times higher risk of developing non-Hodgkin's lymphoma compared to the general population. The warning signs are subtle but critical. Persistent swelling in the jaw, neck, or under the ears that does not fade, night sweats, unexplained weight loss, or worsening fatigue may signal the disease's transformation. Unfortunately, these symptoms often resemble regular Sjögren's flares, which is why many cases are discovered late. Regular blood work, imaging scans such as CT or PET, and prompt evaluation of any unusual swelling can make the difference between early detection and a missed opportunity for treatment. Lymphoma may sound terrifying, but vigilance and routine monitoring dramatically reduce its danger. Awareness is the best defense against fear. And yet, the journey of understanding Sjögren's does not end with its risks, because knowledge must turn into action through diagnosis, treatment, and daily care that give patients hope and control once again. Number 13, diagnosis, treatment, and living with Sjögren's syndrome. After learning about the many faces of Sjögren's, the most powerful step forward is understanding how to confirm the diagnosis and build a plan for lifelong protection. Detecting this condition early requires a combination of tests because no single result can tell the full story. Doctors begin with blood work checking for ANA, anti-SSA, and anti-SSB antibodies, which reveal autoimmune activity. Yet up to one-third of patients test negative even when the disease is active, proving that symptoms matter just as much as numbers. Eye tests such as the Schirmer's test measure tear production, while salivary gland imaging or a lip biopsy can show whether the glands are being attacked. For those with nerve symptoms, MRI scans and nerve conduction studies expose hidden damage before it becomes permanent. Once the diagnosis is clear, treatment focuses on calming the immune system, protecting moisture, and preventing organ damage. Artificial tears, medicated eye drops, saliva substitutes, and moisture gels relieve the most visible symptoms. Doctors often prescribe hydroxychloroquine to control fatigue and joint pain, or immunosuppressants like methotrexate or mycophenolate when deeper organs are at risk. In severe cases, biologic drugs such as rituximab target specific immune cells responsible for the attack. Supporting the body from the inside also matters. Omega-3 fatty acids, vitamin D hydration, and gentle daily movement help restore balance and reduce inflammation naturally. Living with Sjögren's means learning to adapt without giving in. Humidifiers ease breathing and dryness at night. Sugar-free gum stimulates saliva, and fluoride treatments protect teeth. Emotional strength is equally vital. Many patients feel invisible because their illness is not always seen. But community support, online groups, and patient education create connection and courage. Sjögren's is not simply dry eye syndrome. It is a systemic autoimmune condition that demands awareness, early testing, and consistent care. With the right plan and persistence, people can protect their vision, their energy, and their future. And that hope grounded in knowledge is where healing truly begins. Sjögren's syndrome is not just about dryness, fatigue, or discomfort. It is a complex autoimmune condition that can affect nearly every organ in the body. Understanding it means protecting your vision, your nerves, your lungs, and your future. Awareness is the first step toward healing. Every symptom, no matter how small, is your body's way of asking for help. The earlier it is recognized, the greater the chance to slow the damage and regain control. With proper diagnosis, consistent care, and daily habits that support hydration, nutrition, and rest, people living with Sjögren's can still live full, active, and meaningful lives. To everyone watching, know that you are not alone. Millions share this journey, and knowledge truly is power. Keep your environment humid, drink water throughout the day, protect your eyes and mouth with the right products, and work closely with your healthcare provider to monitor your immune health. Stay gentle with yourself on difficult days and celebrate the small victories that prove progress is possible. Every positive change, no matter how small, strengthens your body's ability to fight back. If this information helped you understand your symptoms or gave you hope, save this video and share it with someone who might need it today. Subscribe to our channel for more doctor-approved insights on senior health nutrition and the latest breakthroughs in autoimmune care. In the next video, we will uncover how autoimmune diseases like Sjögren's can mimic other conditions such as arthritis and multiple sclerosis, and how to tell the difference before it is too late. Stay informed, stay empowered, and remember that your health journey can begin right now.